Hello, this is Paul Rothenberg. I'm an orthopedic surgeon in northern New Jersey, and this is an arthroscopic medial meniscus root repair. As I enter the joint, I note that the medial compartment is tight in this patient and is limiting my ability to see the medial meniscus root attachment. Therefore, I pie crust the MCL using an 18-gauge spinal needle while applying a gentle valgus force to the knee to increase my working space in the medial compartment. Once the MCL is released, I'm able to get adequate visualization of the posterior horn of the medial meniscus. In this patient, I can assess the tear, which is a full thickness radial tear immediately adjacent to the root attachment. Because this is an unstable tear pattern in a patient with minimal osteoarthritis, the decision is made to proceed with medial meniscus root repair. The first step is debriding the edges of the meniscus in preparation for repair. Next, a 0 fiber length suture is passed through the posterior horn of the medial meniscus using a knee scorpion suture passer. This suture is then shuttled out of the knee through an accessory portal and tensioned. This step is then repeated 2 more times for a total of 3 fiber length sutures in the posterior horn of the medial meniscus. A meniscus root guide is then introduced into the knee immediately adjacent to the meniscus root attachment. I then advance the flip cutter drill through this guide until I encounter a hard stop marking the end of the guide. The guide is then removed and I carefully, under direct visualization, advance the drill into the joint. The flip cutter is then flipped and a 6 mm in diameter by approximately 1 cm socket is drilled. A shuttling suture is then advanced into the joint and retrieved through the medial portal. I then retrieve the shuttling suture through the accessory portal, and then all the sutures are again retrieved through the medial portal. This will ensure that there is no soft tissue bridges. Now, finally, the meniscus repair sutures are passed through the tibia using the shuttling suture. The meniscus is then tensioned carefully and secured to the tibia using a 4.75 mm swivel lock anchor. The final repair is probed for stability, and the case is complete.